The COVID-19 pandemic caused disruption on a global scale. It plunged Belize into a humanitarian and socio-economic crisis, upending the lives of societies, communities, families, and especially children. Although less likely to experience severe illness due to COVID-19, children were the most vulnerable to its effects. Throughout this period, UNICEF has worked alongside the government of Belize, providing critical support to the national response. To date, over 100,800 doses of AstraZeneca vaccine have been procured through the COVAX facility, supported jointly by UNICEF, WHO, and Gavi. The UNICEF Supply Division also helped Belize procure 148,800 doses of single-dose Janssen vaccines from the African Union's African Vaccine Acquisition Trust. As the COVID-19 pandemic spread, it was accompanied by an infodemic of misinformation, spreading fear and confusion. UNICEF supported the Ministry of Health and Wellness to share information to counter myths and vaccine hesitancy. UNICEF supported training for laboratory staff to conduct PCR tests and contributed to the purchase of 8,000 testing kits. This improved screening services to ensure samples were collected efficiently at all 13 district hospital laboratories and conveyed to the Central Medical Laboratory. $924,000 from UNICEF Global Support, which contributed to the strengthening of the national cold chain system and risk communication and community engagement initiatives. 250,000 freeze tags procured for the temperature monitoring in the vaccine cold chain. 100 cold boxes and 14 refrigerators procured to store vaccines at a stable temperature to ensure they do not degrade. 5 oxygen concentrators procured for oxygen therapy to manage COVID-19 patients with severe respiratory infection. 6,000 pregnant and lactating women learned of the importance of prenatal and postnatal care within a COVID-19 context. The COVID-19 pandemic was unprecedented in its impact. Globally and in Belize, all of our efforts were taxed as we collaborated and responded to save lives, retain hard-won development gains, and regain control over a reality that seemed at times to be spiraling out of control. As we transition to a COVID-19 recovery context, UNICEF pledges its continued support to strengthen primary health care to help us prepare our healthcare workers and health facilities to future pandemics. The country program document of 2022 to 2026 includes an amplified focus on primary health care. We will accelerate support to routine immunizations and strengthening cold chain systems for vaccine management. With support of the people and the government of Japan, UNICEF has already mobilized over $900,000 to support training and procurement of vital equipment to support the last mile push to end the pandemic and to improve the health outcome for children. Because every child has a right to survive and thrive. We will continue to support partnerships and strengthen primary health care in Belize.